I think probably the biggest social challenge perhaps facing our countries in this room, including the U.S. and Japan, is healthcare. And the ability to address the issues as it relates to healthcare, I think a prime example where collaboration will occur. It starts with a common medical record. It starts with the ability to capture your data from wherever you are in your country, to submit that data to the best doctors that you have. The ability for you to be able to do a large part of your own research and quickly understand what are the symptoms, the questions you ought to ask. To be able to do that not by going to a hospital or clinic, but to capture a large part of the data at home and the implementation. The ability to interface to your doctor over a telepresence-like system, probably over your TV at that time with really good camera resolution. The ability to do that off an open standard and system. The ability to check to your parents to see how they're doing, to see if they're following the medical schedules they should be able to do, and to collect the data as well, and with their authorization for you to be able to view that they're doing what they need to be done. So the view of 5 to 10 years out, and the tough part about predicting this is sometimes we're a little bit early, but usually we underestimate it, is that I think this collaborative technology and the ability to communicate in ways we're most comfortable as countries build out infrastructure with broadband not being what we describe it today, but a minimum of 100 megs and a gig being very probable, suddenly changes applications in a very positive way. It will usher in a level of competition that will be very healthy, but a number of companies won't make the transition. And want to be realistic, Cisco may not if we don't move right within it, so balancing the confidence with very healthy paranoia. And I think it's a world that while there will be some challenges introduced, whether it's how do we keep information secure or how do we protect our healthcare records, the benefits will so far outweigh the challenges that we'll probably look back and say, we may have been too conservative. I think the odds on that being right are extremely high. I might be off in terms of 5 years being a little bit early or 5 years being a little bit late, but I think that's the type of capability that's in front of us. If you watch the internet projections we made in the early 90s, mid 90s, late 90s, almost everything we said happened, most of the time at a faster pace than before. Now, that's an optimistic side. I'm an optimist by nature, but I also have a pretty good feel for what we think is possible in the market, and we usually lead by ourselves.